If there's, yeah, just one thing I could say, for pregnant women, I would say focusing on hip stability. A lot of pregnant women, especially later in their terms, they get that kind of that little waddle walk that pregnant women have, because the muscles of the hips are really, really strained to help stabilize that pelvis because their center of mass is shifted greatly with having that child inside of them. Afterwards, for most more postpartum, if there was one thing I could say is really just, immediately get into just something very, very simple. And that's just properly breathing with the diaphragm. The baby was blocking that diaphragm from you. Like every pregnant woman will attest to this. Like they can't breathe, they can't take a deep breath during that whole time. That diaphragm doesn't have room to move. And once that baby's gone, before we jump into really any exercises, we want to go, hey, let's get that diaphragm moving again, because that is the foundation of kind of setting up that core stability and creating some intra-abdominal pressure again, which will help you stabilize the pelvis and the core for future exercises. So starting easy, just doing some breathing exercises immediately postpartum, I think would be the one thing I would advocate.